But there are several things you should know before going under the knife. Our Health Watch reporter Dilby Henry has more.
That's right, me and Dave. Some good tips here from one of the top surgeons in the area. Breast enlargement surgery is, in fact, extremely popular, especially here in Southern California. It's not only popular among young women, but also older women tired of watching gravity take its toll. We talked to one of the area's top plastic surgeons about the A's, B's, and C's of breast augmentation. Countless women are in search of the perfect body, or at least a better one than they already have. We can diet and exercise till we just about drop, but certain spot areas are tough, if not impossible, to change, whether you want that area to be smaller or bigger. For many women, it's their breasts, and breast augmentation surgery is more popular than ever. But top surgeons say you have to do your homework, find a skilled surgeon.
This isn't like buying a pair of Prada shoes or a Gucci purse or whatever. You can't return it if it's mutilated.
Dr. Stuart Lindner is a Beverly Hills plastic surgeon and breast augmentation specialist.
You need to find a board-certified plastic surgeon. There are no substitutes. Anyone with a medical degree can do any surgery, not just plastics, but any specialty in medicine. We don't have a restriction on our license, which can be very dangerous to the consumer out there. I'm not trained in neurosurgery, though I'm allowed to do brain surgery because I have a medical license.
Another word of warning?
If a patient is over the age of 35 or older, we consider that a preoperative mammogram and possibly an ultrasound be required prior to having breast surgery.
And if there's a family history, the same applies regardless of age. Also,
the patient needs to be evaluated once, if not twice, before surgery by the plastic surgeon.
In terms of size, Dr. Lindner suggests making that decision based upon your body type, your lifestyle, and personal desire.
You can't say, hey, my girlfriend has this, so I think this is great for me. The bodies are different. The breasts are different. We have to tailor each surgery to each woman's needs.
There's also a new trend in terms of size.
Interestingly, we're now in 2006, and I'm starting to see a slight downsize in terms of breast implant volume. 3-4 years ago, women were going larger. They were going full C, small Ds, definitely into the full Cs. I'm starting to see more women going to the mid-C categories.
Regardless of size, one of the most popular implant choices nowadays, this new HP profile implant.
They want fuller breasts, but they don't want them too wide on the side. They want them more tapered so you don't look matronly. So the high-profile HP high profiles are fabulous. I love these implants. We use them every day because they give more projection and less width on the side.
Another trend, more and more older women, many of whom have already had children, are looking for a little lift. Regardless of what brings you into the surgeon's office, just remember the golden rule of plastic surgery.
You need to do your homework.
Absolutely. Dr. Lindner is also a member of the American Society of Plastic Surgeons, a designation you'll also want to look for in search of a surgeon. Now, for more information on this topic, you can go to our website, KCAL9.com, and click on the links and numbers. But certainly some excellent tips there, especially about the mammogram. A lot of women may not know that, and really taking your time to make the decision.